Welcome to forpay.org. This is Consumers Dr. Vingal. I've been talking about healthcare, bills, and payments, and let's look into how you can save money in healthcare. Paying your doctor in cash could save you money. This is from the consumers reports, folks. Even if you have health insurance, sometimes you're better off not using it. I'll tell you why and how. A growing number of medical services, from MRIs to blood work to outpatient surgery, could cost you less. Sometimes a lot less if you pay the provider out of pocket from your own pocket and leave your insurers out of the picture. Yes, that this is possible, in contrary to what many of us have come to understand about how health insurance is supposed to work. We think using it always saves us money, partly because we assume our insurer negotiates the best rates for health service. That's we assume. And partly because we expect our insurer to pick up the tab. Whatever cost remains, or at least much of it. Yes. In many cases, that is still true, but not always. Not always. Especially for growing number of people in high deductible plans who must spend thousands of dollars on health services before insurance even starts to kick in to cover some of the cost. According to experts, Consumer Reports talk to and review of pricing options offered by dozens of healthcare providers. More doctors, hospital networks, and treatment centers are touting big discounts for patients who pay cash upfront and forego using their insurance. Companies like MD Save, with network of hundreds of hospitals, clinics, labs, and doctors in 25 states, illustrates the shift. It builds itself as an online healthcare marketplace, folks. Online healthcare marketplace that connects healthcare providers offering big discounts to people willing to prepay their bill online. Yes, online. We will talk about many more in regards to the managing your healthcare costs. I will be talking in the next episodes, I'll be talking about should you ever have to prepay a hospital bill, or how to survive a high deductible health plan. We'll talk about that. Lowering your drug costs with this. There are 6 hacks you can lower your drug costs. Guide to, and also Consumer Report guide to health insurance. We'll be talking in series in the next few episodes. Like homeowner and auto insurance, health insurance protects you from financial shocks that could bankrupt you if you or any family member has a medical crisis. Yes, has a medical crisis that requires a major hospitalization or expensive treatments. But as consumers should shoulder more of their cost of their care if they're seeking ways to save money, folks. If they're seeking ways to save money, especially with discounted health insurance plans. Healthcare providers are finding that by charging people who pay cash less than insurer negotiated rate, some of the health services, they can come out ahead financially too. Even the providers will come out financially too. Says Bill Campion, a co-founder and a senior vice president analytics at Healthcare Bluebook, which uses insurance claim databases to estimate prices for medical care. Healthcare providers make up for charging lower prices in other ways. Campaign says cutting out the insurer as a middleman can significantly reduce the provider's administrative and billing cost. Yes, providers will save lots of money too. Not only the customer, even the provider. And the healthcare providers who get cash up front don't have to chase down the money later, either from a patient or from the insurance company. It is much easier transaction in a cash payment environment, as per Campaign. Where can you save? Reduced fees for paying cash are more common for diagnostic procedures. Yes, such as CAT scans, X-rays, ultrasounds. But cash payers can also often get better deal for certain lab work, prescription drugs, outpatient surgeries, and therapeutic services such as physical therapy. Some imaging centers even offer off-pay discounts for patients who pay cash and use services after traditional business hours, like MRI after 7 p.m. It is like a surge pricing by Uber. Yes, it is like basically after hours they can charge you less. Healthcare prices allows you to compare costs for specific procedures at different providers around the US. There is a website called Price Check Tool. Price Check Tool gets data on insurance negotiated prices, Medicare rates, and cash prices directly from healthcare providers as well as from patient crowdsourcing, folks. Patient crowdsourcing. Differences in prices can be significant. A woman in Louisiana who shared a story with clear health costs, reporting paying $766 for echocardiogram using her insurance. She later learned the cash price for the same procedure was almost half, such as $400. When cash payments can cost you, even if you pay cash, is likely to reduce your annual outlay for medical expenses. There are some important drawbacks in paying cash. The main one is that money you spend typically won't count towards the deductible. As a result, those dollars will be wasted. And if you need medical care that requires you to meet your whole deductible anyway, you need to look into that, folks. You really need to look at it. So the money you spend always may not be counted towards your out-of-pocket maximum, which caps the total amount you owe for deductibles, co-pays, and co-insurance. After you meet your out-of-pocket max, your insurer, your insurance company, picks up 100% of your costs. The smart way to pay is by cash. Here's how to figure out whether paying cash directly then or using your insurance. Here are the tips, folks. These are the right moves for you. Number one, weigh the situation. Whether it makes sense to use insurance depends on your special circumstances. Cash payment generally makes sense only if you're seeking care subject to a deductible which haven't met yet and don't think you will reach anytime in the same calendar year. Of course, deductibles reset annually. You never know when you will get sick and need expensive medical care. Make sure they put enough money aside to meet your deductible. Number two, research, price, and cost compare. Healthcare prices vary widely, even within the same local area, especially by provider. So it is important, especially it's important to shop around.